Treating your snoring and sleep apnea, how a dentist can help. What is snoring? Snoring occurs when soft tissues vibrate in your upper airway while you sleep. Snoring is more common in men, but women can snore too. It is more common in women during pregnancy and menopause. Smoking and alcohol use can lead to snoring, and it's also more common as weight increases or when you have trouble breathing through your nose. Snoring can be a sign of OSA, but it can also occur on its own. Not all snorers have OSA. Snoring, sleep apnea, and sleep deprivation are extremely common in the US. Who snores? 40% of adult men, 24% of adult women. What is obstructive sleep apnea OSA? OSA happens when soft tissue around the airway relaxes and collapses during sleep. When your muscles relax, they can collapse and block your airway. These breathing pauses, or apneas, temporarily cause dips in oxygen. OSA can cause you to stop breathing hundreds of times per night for anywhere from a few seconds to more than a minute. This can cause you to wake up many times without you even realizing it. This can make sleep unrefreshing, leading you to be tired when you wake up. This constant sleep interruption can lead to many health problems. Sleep apnea is very common in the US. One study estimates that as many as 54 million Americans have OSA. Do you have any of these signs of OSA? Snoring, choking or gasping while sleeping, being tired during the day, morning headaches, frequent use of the bathroom at night, difficulty concentrating or remembering things. OSA impacts your quality of life. Health problems associated with OSA: diabetes, heart disease, high blood pressure, cognitive issues like brain fog and dementia, impaired immune system, other serious diseases linked including cancer. What are my treatment options? CPAP, continuous positive airway pressure. Effective therapy but requires consistent nightly use. Downsides: bulky, noisy, mouth-breathing discomfort, frequent maintenance. Oral appliance therapy, OAT, lightweight, quiet, and comfortable. Studies show it's just as effective as CPAP in treating OSA due to higher patient adherence. Surgical treatments, reserved for severe cases, permanent but invasive. Hypoglossal nerve stimulation, implanted device that stimulates the nerve, moving the tongue to keep airways open. Oral appliance therapy is as effective as CPAP. Oral appliances are lightweight, quiet, easy to use, and comfortable to wear. CPAP is a commonly prescribed treatment and can be an effective therapy if you wear it all night long, every time you sleep. With a CPAP machine, you wear a mask with a tube that is hooked up to a machine, and it blows air down your throat while you sleep. There are all types of masks available. Some of these masks can lead to mouth breathing, which can cause dry mouth and discomfort. Other patients do not like the noise of a CPAP machine or how bulky it is. Additionally, you have to get new tubes and masks several times throughout the year. You also need electricity, and most often distilled water. These are just a few of the reasons that people tend to give up using their CPAP. On the other hand, people tend to prefer oral appliance therapy because appliances are lightweight, quiet, easy to use, and comfortable to wear. Study after study has shown that OAT can be just as effective as CPAP in treating OSA. While CPAP works quite well in lab settings, in the real world, patients do not tend to like the treatment as much, and thus do not use it as often as CPAP. An oral appliance can help you just as much as CPAP because you are more likely to use it every time you sleep. What is an oral appliance? An oral appliance is a device worn in the mouth during sleep. It fits like an orthodontic retainer. A custom-fit oral sleep appliance is an effective treatment that prevents the airway from collapsing by supporting the jaw in a forward position. Oral appliances can help treat both snoring and sleep apnea. 6 steps for starting oral appliance therapy. 1. Screening. Do you have any symptoms? A qualified dentist asks a number of screening questions. Your height, weight, and blood pressure are taken. You might also have an X-ray or pictures taken of your mouth. 2. Diagnosis. Talk with your medical doctor. Be prepared for a sleep evaluation and sleep test. 3. Making and fitting your oral appliance. Impressions will be taken by your qualified dentist to make a custom appliance just for you. Adjustments will be made by your qualified dentist as needed. Learning how to properly care for your device is important. 4. getting your appliance in the right position. An open airway and a comfortable fit is the goal. You might be asked to run a few tests while you sleep. Your physician is kept updated on your treatment. 5. Follow-up visits. Is the device doing its job? Your qualified dentist will schedule yearly assessments. These appointments are about making changes if needed. The top goal is to make sure you're comfortable. 6. Living with an oral appliance. Ease of use means ease of mind. Oral appliance therapy is small, quiet, easy to use, and comfortable. Getting the right treatment is helping your overall health. What about side effects? Patients can experience side effects from oral appliance therapy. Side effects tend to be mild and correctable. A qualified dentist is trained in how to minimize side effects using techniques to increase comfort. This could include exercises or using a morning device to strengthen the jaw or fixing any trouble spots on the appliance. Most patients tend to be very satisfied with their oral appliance and find them very comfortable. Ask your qualified dentist how oral appliance therapy can make a difference in your life.